when we did the start of Operation Seek and Save, 55% of Barbadians being interviewed initially expressed hesitancy and concern about whether they would take a vaccine, and 45% said yes. Within 2 weeks, that started to change, and we saw a complete difference in the trajectory of interest in the vaccines. Within a month of that initial position, we saw and had data that suggested that 79.8%, almost 8 out of every 10 Barbadians said, give me the vaccine, we want it. And 2 out of every 10 said they were not sure or they were not taking it. Our duty as a government has been to ensure that every Barbadian citizen and resident who wants the vaccine can get the vaccine on demand. And I set this out as an objective of this government 2 months ago. We have worked tirelessly day after day, and while Jeffrey, you thank me, the truth is that my job is easy in terms of setting priorities, but our job is difficult in terms of making those priorities work. And therefore the thanks should be extended not to me, but to all of the public servants and all of the members of Barbadian community and visitors who have worked arm in arm with us, hand in hand, to make sure that we literally can deliver vaccines to the people of this nation and to the people who happen to be living here as well. So I thank the members of the Ministry of Health, Barbados Defence Force, Major Clark and Dr. Ferdinand and Ms. Chantal Monroe-Knight, who have been on the front line of executing that, but who could not do it without the able assistance of Sister Cook and all of the public health nurses. And of course, Mrs. Hines, you're trying to ease into the back there, but the Barbados Drug Service has been critical in being able to allow us to prepare, so that when people asked us about managing cold chain and all of these things, we've had it. But the difficulty has not been that. The difficulty has been dealing with pharmaceutical companies who want non-disclosure agreements signed without any kind of exception, and who say to you that we can tell you that we will charge you X, but we are not allowing you to be able to say this to anybody else globally. And that is why I say to you that the global leadership is required, because it is clear to us that we are going to be in this battle for some time still, largely because we have not acted in a coordinated way globally. But to the extent that we accept that we're going to still be in this battle, then there are some urgent things that need to be done. One, we can no longer use crass proxies and criteria for determining access to therapeutics and vaccines, such as maternal mortality, which has absolutely nothing to do with whether a country needs vaccines or therapeutics urgently. Secondly, we must address the issue fundamentally of production. You cannot have the kind of constrained production in a world today that has been fighting this virus for over 12 months. The fact that we have not planned out production better, particularly in large continents like Africa and Latin America and the Caribbean as a sub-region, is perhaps regrettable, and an absence of the kind of coordinated foresight that was required if we were going to get on top of this early. And I suggest to you, better now than never, because this is not going anywhere in a hurry. And I happen to know, as the chairman of the One Health Global Initiative, that the biggest battle that the world will face between now and 2050 is the battle dealing with antimicrobial resistance, what we call the slow motion pandemic. And the mere fact that I'm using that P word again should frighten everyone globally, because the slow motion pandemic has the potential to make a visit to the doctor or the rearing, or simple childbirth, an exercise now that will be like Russian roulette.